It's about anatomy for obstetrician and gynecologists. Anatomy is basically a very vast subject, but here we will just concentrate on those points which are important for an obstetricians. Okay, so first of all, let us concentrate on certain ligaments of the uterus, because different MCQs are asked related to this point, that what are the basic supports of the uterus. You all know that we have uterosacral ligament, cardinal ligament, broad ligament, round ligament, and you can see here in the figure we have round ligament like this one, and that is the suspensory ligament of the ovary. Ureter is here. We have the cardinal ligament, uterosacral ligament, uterus, and fallopian tube. Now, fallopian tubes have different parts: isthmus, ampulla, and infundibulum. This is the infundibulum, this is the ampulla, this is the isthmus, this is the interstitium part, and that is the femoral end. Okay, and the type of pelvises we have gynecoid, android, anthropoid, and platyploid, and I have explained a little bit detail of these videos, these pelvises in a different video. You can check on YouTube. Now, this figure is very important. What are the effects of fetal attitude on the presenting diameter? Fetal attitude may be flexed to extended. Okay, attitude may be well flexed, so that indicates the suboccipito-bregmatic 9.5 centimeter. It may be less well flexed, like partially extended or deflexed, which shows the occipitofrontal diameter of the fetus and 11.5 centimeter. Okay, and if the fetus head is extended, then the presentation will be bro, and the diameter, the presenting diameter of the fetus will be occipitomental, that is 13 centimeters, the maximum diameter. And when it is fully extended, then the delivery will be in the face presentation, and the diameter will be reduced to submentobregmatic, that is 9.5 centimeter. Okay, so quick review of this chart is very important. Perineum is divided into anterior urogenital triangle and posterior anal triangle. Okay, so urogenital triangle is basically, I will show you the figure in the next slide, but just have a quick review that urogenital triangle is associated with the opening of urinary system and reproductive system and function to anchor the external genitalia. So you can see from this finger that this is the urogenital triangle. Okay, so it is associated with the opening of urinary system and reproductive system and function to anchor the external genitalia. Now, anal triangle, you can see from this figure, this is the anal triangle. Okay, an anal triangle contains anus and external anal sphincter, and pudendal nerve S2 and S4 and internal pudendal artery are the major nerves and artery of this region. Okay, pudendal nerve and internal pudendal artery. Okay, so you have to remember this. Okay, so this is the figure which I was explaining. Basically, I explained to you the urogenital triangle and the anal triangle here. You can also see the coccyx here. You can see the sacrotuberous ligament here, extending from sacrum to the tuberous ischial tuberosity. This is the ischial tuberosity, ischiopubic ramus, pubic symphysis, and levator anamesis. Okay, so this is another figure in which we are shown the inferior pubic ligament. We are seeing from the downside, we have the urethral ligament, we have vaginal opening, and then we have the external anal sphincter containing the deep superficial and subcutaneous external anal sphincters. Okay, we may have other parts like anal aperture, external anal sphincter, and perineal body between the vaginal opening and anal opening. And then we have perineal membrane as well. Ischiorectal fossa. Okay, you can see from the another slide the shape of the ischiorectal fossa. Okay, but a little bit detail about ischiorectal fossa. It is renamed as the ischiorectal space since it is located between the ischial tuberosity and anal canal, not in the rectum. So ischiorectal fossa name has been replaced with ischiorectal space. The ischiorectal fossa is fat-filled space on either side of the anal canal, and it fills the majority of the anal triangles, and it contains adipose tissue and inferior rectal nerves and vessel. Okay, so what is its content? Basically, adipose tissue, and inferior rectal nerves and vessels. The right and left fossa allow the distension of anal canal during defecation. Ischiorrectal fossa boundaries you can see from the figure. Laterally by the ischium and inferior part of obturatus internus covered with obturator fascia. So in the figure you can see fascia covering obturator internus that forms the lateral boundary. Okay, the ischium and obturatus internus with the fascia covering obturatus internus. Okay, and medially by anal canal, to which elevator ani descends and which the external anal sphincter surrounds. Posteriorly by the sacrotuberous ligament and gluteus maximus, anteriorly by external urethral sphincter, deep transversus perineal muscle and their fascia. These parts of the fossa superior to the perineal membrane are known as anterior recesses of ischiorectal fossa. Now, a little bit about vagina. Vagina is a narrow, muscular but not elastic, narrow, muscular but elastic organ having length of about 4 to 5 inches in an adult woman. Okay, and it connects the external genital organ to the uterus. All of you know this, and the vagina is the main female organ of sexual intercourse. It acts as a passageway for the transportation of sperms and for the expulsion of the menstrual blood. It helps in the delivery of the baby as well. The lower end of the vagina lies at the level of the hymen, and at this level it is surrounded by erectile tissue which correspond to corpus spongiosum of the male. Now, blood supply of the vagina. Arterial supply, the vaginal artery from the internal iliac artery. Additional branches from middle rectal artery from internal iliac artery, inferior rectal artery from internal pudendal artery of the internal iliac, vaginal branches of the uterine artery. Lymphatic drainage of vagina. Lymphatic drainage of vagina is generally to the external iliac node, upper part of the vagina. Okay, so upper part of vagina drains to the external iliac node, the common and internal iliac node, the middle part, and superficial inguinal and perirectal nodes, the lower third. Okay, you can see from the figure. And then the space of radius is also a little bit important. Sometimes the question is asked about this. It is basically the pre-vesical or retropubic space of radius. These are another names, and it is the area lying between the bladder and symphysis pubis. Okay, thank you so much. That was a little bit about the anatomy. Allah Hafiz.